Dear students, let's look at this MCQ. Pancreatic insufficiency can lead to what kind of vitamin deficiency? This is the logic. Folic acid, ascorbic acid, pantothenic acid are all easily absorbed. They are not very complicated. But when it comes to B12, first you have to understand B12 is bound inside the food. From the food, it has to be released. Again, this has to be bound to something called as cobalophyllin and haptocorin, and they'll be reaching the stomach. When they try to come to the duodenum, in the duodenum, you will be having the pancreatic secretions which contain trypsin. That particular cobalophyllin plus B12 complex will be acted upon by the trypsin in such a way the cobalophyllin is knocked off so that B12 becomes free. Only when the B12 becomes free, that B12 can bind to intrinsic factor. Remember, B12 is not solely absorbed in the intestine. It is bound to the intrinsic factor. So B12 becomes the extrinsic factor. This intrinsic factor, extrinsic factor complex alone can be absorbed. Independent extrinsic factor called as B12 cannot be absorbed. For this B12 to become a complex with that of intrinsic factor, it should first be knocked off because of the cobalophyllins binding. So trypsin is essential, and trypsin comes from the pancreas. So remember, trypsin causes hydrolysis of cobalophyllin and dissociates the vitamin B12 from that of cobalophyllin, making it free to bind with the intrinsic factor. So in case of exocrine pancreatic insufficiency, a patient can undergo cobalamin deficiency because of poor absorption of cobalamin. I hope this answer helps you. All the very best.